Imagine not being able to get medicine when you really need it. Some people recovering from substance abuse are running into this roadblock.
Tonight's Addicted Utah report, we found a new federal bill is looking to provide some relief, and it has some wide-ranging bipartisan support.
Joe Estes grew up around drugs and alcohol.
Telling myself I would never go that route. I would never end up being like that too, you know.
But he started using at an early age, and that led to a heroin addiction. He knew getting sober was not going to be easy.
My heart felt like it was going to beat out of my chest, and I'm like, oh my God. Oh, wow. Here we go.
3.5 years later, Joe is still clean, but he relies on a regular dose of methadone for pain management and to control relapsing.
Withdrawal's just like the flu. You know, I mean, it feels like you're going to die, and, you know, because it's just people that pass away from their withdrawal.
But getting more than a single dose of medicine is rare. That is unless a bill on medication-assisted treatment, also known as MAT, making its way through Congress right now, passes.
We're so careful the way we prescribe these medications, but sometimes a little too careful.
Congressman John Curtis is not the sponsor, but supports the bill that would allow someone to get 3 days of methadone or Suboxone instead of just 1 dose.
And some of them turn back to the drugs that brought them there, and so we're trying to fix that problem.
The bill's focus is for people right after an overdose that go to an ER, and the aim is to give them enough medicine until they can get into treatment.
You know, this is one thing that somebody can be living under a bridge, you know, 1 week, and then, you know, and 2 weeks later, they're like functioning and working.
Carol Sheen Powell, the director of recovery with Four Corners Behavioral Health, says MAT essentially eliminates withdrawal symptoms. But what's lacking, according to a Gardner Policy Institute study, is MAT availability in Utah, specifically in rural areas. Powell says her clinic is the only MAT program in the Four Corners area, covering Emery and Carbon counties.
My clinic is so busy since we've opened. We have overshot the number of patients that we initially set out to serve.
Out to serve people like Joe, who is not afraid to say sometimes he needs a little extra help.
I think it's important that people treat people that are in recovery with a little bit of trust. Yeah, definitely save lives. You know, like I said, methadone saved my life, for sure.
Now, if passed in its current form, the DEA would have to change their policy somewhat to allow for multiple days of doses. Neither the DEA or the U.S. Attorney for Utah would comment for this story since the bill has not yet become law. For more information and stories about addiction resources, visit the Addicted Utah page. It's on KUTV.com.